Hi guys, my name is Carlos and I'm going to be talking about therapeutic use of exercise. So a nice quote that I got from the book is in general, any form of exercise, if pursued continuously, will help train us in perseverance by Mao Zedong, which I actually find is very, very true. So what is therapeutic use of exercise? Therapeutic use of exercise is the implementation of planned physical activity to improve function as well as remediate impairments to meet treatment goals. Some uses of therapeutic use of exercise include, but are not limited to, improving ambulation, joint mobility, circulation, respiratory capacity, coordination, balance, relaxation, strength, endurance, body composition, and enhance mental health. So basically, therapeutic use of exercise improves in all these areas I just mentioned. So now, what exactly is exercise? So exercise as a term is extremely broad and encompasses practically all human movements, including but not limited to random movement, habitual activity, training done for fitness and health, dance, sports, and recreational activities. There are some key motives on why a person would participate in exercise. Some of them being a desire for affiliation, being self-conscious about physical features, their desire to improve health, reduce stress, improve mood, and or improve energy, which all of these things are something that exercise does in fact provide. Some of the motives a person might have will be guilt for any reason, fear of being a burden and not being healthy and having to go to the hospital often could also be that, and just in general pain. It is imperative to understand some of the motives that encourages people to exercise, to use them as a strength, and to encourage our clients as a therapeutic recreational specialist to participate in exercise. Now, the history of exercise, of therapeutic use of exercise. So, in ancient societies, it was vital for us humans to be physically active for survival, to run from danger, hunt for food, and physically carry anything they needed to use. If you were not physically active, most likely you will not survive long back then. A sedentary lifestyle were basically non-existent back then. Records state that there was organized exercise for health promotion in China around 2500 BC. So, history, the records of history state that exercise for health promotion has been around for a super, super long time, and it was used in basically before even that, just to survive essentially. And that's why we humans are built the way we are, with our joints, how our muscles work, how our body systems work, just to survive. And that's why when people live a sedentary lifestyle, it is very detrimental to the health, and a lot of people die from that. It's actually a leading cause of death now. Well, not the leading, but a leading. Also regarding history, Hippocrates and Plato from 460 all the way to 370 BC believed in the importance of being physically active. Their philosophy means that the importance of being physically active is that it improves their well-being and it's useful in treating disease and promoting health. Now, in 2015, that's when this study was done. So recent times, 81.6% of adults and 81.8% of adolescents do not achieve recommendations for physical activity, which is not even that much either. So it shows that there's a very, very big problem going on in this world right now. The World Health Organization has done a study and can conclude that 60% of the world's population is not active enough to reduce health risk right now. So there's been a lot of measures, organizations being created to help improve education about health and fitness, and to encourage a lot of people around the world to participate in exercise right now, to help remediate all the illnesses that can happen when people don't exercise. That can happen when people live a very sedentary lifestyle. So the goal of using exercise as a therapeutic medium is to increase the total time that a participant engages in physical activity over the course of each day. So therapeutic use of exercise serves to meet functional, expressive, and leisure needs. The research also supports that it supports. The research states basically that exercise helps support muscular strength, endurance, flexibility, optimal body composition, cardiovascular functioning, mental health, cognition, and a healthy life activity. Exercise can also contribute to psychological health and physical fitness. Some of these psychological benefits are improved mood states and self-esteem, decreases in state anxiety, mild to moderate depression, neuroticism, and stress. However, there are some barriers to exercise, and a recreational therapy specialist should be aware of these barriers, see if they can find these barriers in their potential clients, and help alleviate these barriers or completely remove them at all. So they can encourage the client to participate in exercise. Some of these barriers are presence or absence of biological cues, physical limits, cognitive limits, and motivational limits. Motivational factors are actually the most controllable, but the most common limitation people have in why they don't participate in exercise. Now, to explain a biological cue, this could mean like when an obese person thinks they do not need to exercise because their vital signs are good, they're not in pain, and or they feel good, so they don't think they're in any trouble yet. However, additional barriers also include low perception competence, anxiety, and issues related to perfectionism. So now that you know most of the barriers that occur to people that prevent them from exercising, we should address these barriers. So to address these barriers, some things we could do or to help the client do is to help them develop routines, provide them with social support, reinforce activity without stressing perfect form, and instill values of healthy living. So if we break down these barriers, we can help our clients actually participate in exercise more. Why do we participate in unhealthy behaviors that are not in our interests? So there's this idea out there that the self-defeating activity habits that we participate in are associated with personal beliefs that the benefits outweigh the costs. Benefits of an unhealthy habit are experienced quickly, while long-term consequences such as weight gain, heart disease, etc., are experienced for months or even years. So basically, we get immediate gratification. Therefore, a therapeutic recreation specialist should help people create a lifestyle that generates a balance between immediate gratification and development of long-term healthy habits. To promote physical activity and exercise and reduce sedentary behavior, physical activity has to be linked with improved energy levels, mood, and concentration. Okay, so let's get to the key terms. So these are some key terms one might find in when talking about exercise or in the physical world, in the physical fitness world. So wellness is the generalized state of good health that includes optimal functioning of one's body and mind. Physical wellness is the total body soundness, which includes body size, shape, body function and strength, resistance to disease, and etc. Exercise is actually the type of physical activity that involves a deliberate, planned, and repetitive bodily movement done to improve and or maintain components of physical fitness. Some types of exercise can be anaerobic, which is activities performed without using inhaled oxygen. This could be weightlifting and other activities that don't require a lot of oxygen. Aerobic exercises are activities that require oxygen for prolonged periods of time and place demands on the body that requires it to improve its capacity to handle oxygen. Think of running, jogging, walking, all those kind of things. So physical activity is a broad term and basically means bodily movements produced by skeletal muscles that result in energy expenditure that is often measured in caloric expenditure. So physical activity ranges from turning pages in a book to rock climbing and running a marathon. Basically means anything as long as you're moving and burning some calories. Participating in physical activity protects an individual from cardiovascular and lung disease, several types of cancers, and diabetes, where an absence of participation in physical activity is linked with obesity, high blood cholesterol, hypertension, and death. Physical fitness is the level of physical condition people achieve related to their ability to participate in typical daily tasks and/or recreation activities. This is basically viewed in relation to the person's characteristics. These characteristics are age, occupation, preferences, disability, needs, goals, and the task that must be performed. Essentially, fitness involves participating in exercise, both anaerobic and aerobic, to achieve an optimal level of physical condition characterized by muscular strength and endurance. Performance-related fitness. So this is the development of qualities that enhance the performance of physical activities. In this kind of fitness, the individual is concerned with improving performance-related skills. Some of these fitness skills are agility, which is changing direction rapidly; balance, maintaining equilibrium while stationary or moving; coordination, which is to execute movements smoothly and efficiently; power, produce force at a fast speed; reaction, physically respond to stimuli quickly; and lastly, speed, which is to move your body quickly. Cardiovascular endurance. This is the ability of the heart, blood vessels, blood, and respiratory system to supply fuel, mostly oxygen, to muscles during sustained exercise. This can be achieved through aerobic exercise that promote cardiovascular fitness. One measure to determine cardiovascular endurance is by determining a maximum rate of oxygen consumption represented as VO2, which is typically used to measure the intensity of the exercise. A lower pulse rate and blood pressure during exercise and better adaptation of circulation and respiration to effort are characteristics of improved endurance. As a therapeutic recreational specialist, to improve cardiovascular endurance in a client, the client has to engage in aerobic exercises to increase and sustain the heart rate for a specified period of time. Some of these exercises could include dancing, walking, cycling, rowing, jogging, hiking, and running. Some key factors that a therapeutic recreational specialist has to work with to improve cardiovascular endurance is frequency, intensity, duration of involvement, type of activity, and adherence. As frequency of cardiovascular activity increases, so does the ability to consume oxygen and circulate one's blood. The therapeutic recreational specialist has to determine how frequent the client can participate in aerobic exercises according to their characteristics, but also enough to improve the endurance. It is recommended to do 3 times a week of vigorous exercise, and if you're doing moderate, 5 times a week. So intensity for cardiovascular endurance is described as the level of achieved maximal heart rate. Duration of involvement is the amount of time one's target heart rate is continuously sustained. Duration is important because it contributes to increasing cardiovascular functioning. Type of activity is in reference to which large muscle groups are used during an exercise. And lastly, for exercise to be effective, adherence is necessary. There is little documentation of effects of the techniques designed to promote adherence. Lack of time, socioeconomic status, demographic variables, biomedical status, and access to facilities are some factors that can determine a patient's adherence to exercise. Muscular performance. This involves the capacity of a muscle to do work and is influenced by all body systems. Strength, power, and endurance are key elements of muscle performance. Any impairment to any of these elements results in a decrease in function and disability may occur. Muscular strength. Ability. Muscular strength is the ability of a muscle or a muscle group to exert force against resistance during a single effort or repetition without regard to velocity of the movement. So a single effort is a repetition. This is basically the amount of force or weight a muscle can exert. Muscular strength also decreases chances of injury, back pain, poor postures, and increases athletic performances. Results show that resistance training to increase strength decreases risk of coronary artery disease, osteoporosis, diabetes, and cancer. So when training muscles basically in a anaerobic way, there is this period called the recovery period, is when the individual gets adequate rest between strength exercises, and it's during this time that the muscles build slightly higher levels of strength, and the more times you repeat this, the more strength it gains over time. These periods typically last 48 hours, which is why I recommended that strength training for specific, like if you do chest day for Monday, it is recommended to wait at least 48 hours to do your next chest day, as long as it's not sore, so you don't overtrain it and risk injury. So some considerations for muscular strength that a recreational therapist can oversee is muscle contractions and amount of weight. Some different muscle contractions are isometric contraction, which occurs when the muscle contracts to produce tension, but there is no change in length. A concentric contraction is when the muscle shortens in length while producing tension. Eccentric contraction is when a muscle lengthens while still applying force. When weight training for strength, heavier weights with low repetitions should be used. Muscular endurance. This is the muscle's ability to repeatedly contract and lengthen between a 2 to 3 minute time frame, and that provides an indication of how long the muscles can perform various activities. Increases to muscular endurance prevent the body from tiring during daily activities. Anaerobic and aerobic exercises can be used to increase muscular endurance. Some exercises that improve muscular endurance are calisthenics, jogging, swimming, weight training, and aerobic dancing. Some considerations for muscular endurance that a recreational therapist can use are the amount of weights used, which for muscular endurance it's higher reps and lower weights, which in contrast with muscular strength is lower reps, higher weights. As well as duration of exercise, which is typically 12 to 20 repetitions for 3 sets, type of exercise activity, what muscle groups are used, and repetition of exercise, the number of times a participant can tolerate using a specific amount of weight. Muscular power, I skipped that one by accident. Muscular power is an aspect of muscular performance and is related to strength and speed of movements. It is defined as work produced by muscle per unit of time. So by accident, I skipped that one. So now we're going to body composition, which is the level of a person's body fat weights in relation to lean body weights. So in body composition, there is body fat weight and lean body weight. Body fat weight is the essential and non-essential body tissue. Lean body weight is the muscle, bone, skin, water, and organs of the body. Body composition is influenced actually by gender, age, how much exercise the individual does, and their diets, and is also an indicator of physical fitness. Body composition plays a role in how fast or how slow a person develops fatigue during aerobic exercise. So flexibility now. Flexibility is the ability of a muscle group to elongate, enabling the joint to move through a range of motions. The ability to freely move muscles at joints or group of joints. So some benefits of flexibility is to improve and or maintain posture, reduce muscle soreness, and prevent muscular rigidity. There, there are about three different kinds of stretching. The most common is static stretching, which is stretching the muscle to a point of mild discomfort and holding for 15 to 30 seconds. This generally leads to no injuries. Dynamic stretching, however, includes repetitive bouncing movements to produce muscle stretch, and this can actually cause soreness or injury. The third kind of stretching is proprioceptive neuromuscular facilitation, which is mostly used in a clinical context and is characterized by contraction and relaxation of muscles through a series of motions intended to enhance active and passive range of motion, and this may actually cause soreness. Now, range of motion is the degree to which a joint can flex and extend. Okay, so the theoretical foundations for therapeutic use of exercise is that first and foremost, authorities estimate that half of all participants fail to comply with an exercise regimen, often due to not having appropriate short-term goals. It is of extreme importance to develop short-term goals for motivation and behavior change. You need short-term goals to stay motivated and to influence behavior change. And this is grounded in the social cognitive theory. A second theoretical foundation is the health belief model. This stresses cognitive influences on behavior. An individual's beliefs about the susceptibility and severity of an illness combine to form a perceived threat of illness. The more that people feel threatened by illness, the more likely they will participate in actions that promote health. Another theoretical foundation for therapeutic use of exercise is the theory of reasoned action. So this theory is basically saying that people are usually rational and make predictable use of information. Intentions are the most immediate influence of behavior, which are influenced by positive or negative attitudes regarding behavior and perceived norms. Another theoretical foundation is the theory of planned behavior, which says the importance of perceived control, attitudes, and social expectations on intentions to participate in physical activity. A client's intentions grow stronger as people perceive control, or as the client perceive control over the action. So, if a person thinks they can control exercise, they are more likely to continue exercising. Therefore, a therapeutic recreational specialist should provide social support to a client and also give the client control within the program to encourage the participation in exercise. Two more models or theoretical foundations that therapeutic use of exercise is based on. Another one is trans-theoretical model, which is views behavior change as a spiraling continuum that moves from a stage of no intention to change, which is stage 1, through 6 other stages leading to stage 7, which is change being part of an individual's life. Self-efficacy is vital in this model. So the 7 stages in order is pre-contemplation, contemplation, preparation, action, maintenance, termination, and relapse. So basically, the client starts off not wanting to change whatsoever. Then they contemplate it. They start getting emotionally, cognitively, physically prepared. Then they start making the change. They keep at the change for a couple months, and sometimes they will stop doing it after a while and relapse. But however, they will not start from stage 1, which is pre-contemplation again. They will start in any other stage after that and continue the cycle until the change becomes part of the individual's life. The last theory or theoretical foundation that therapeutic use of exercise is based upon is the self-determination theory. So the degree to which a sense of the basic psychological needs, autonomy, competence, and relatedness are fulfilled or not achieved is the basis for personal differences in motivation. So using the self-determination theory for therapeutic use of exercise, if situations or exercises are established in which active activity or actually participating in exercise addresses these three needs, which is autonomy, competence, and relatedness, then the motivation for the clients will be stronger to exercise, and adherence is more likely to result, and they will keep sticking with exercise and they will continue to exercise for a while. So now let's talk about the effectiveness of exercise on childhood obesity specifically. So in the first study by Knopfler and his colleagues in 2008, they investigated effects of an 8-week multidisciplinary program that includes physical activity on 130 obese children and adolescents. The results of this study proved that there was significant decrease in body weight and body fat percentage of those who exercised, and there was significant increase in quality of life and aerobic exercise. Included in this program, there was moderate calorie restriction, there was physical activity, and there was behavior modification. The second study is by Daly and colleagues in 2006, which examined the effects of a 14-week exercise program on 81 adolescents who were obese or morbidly obese, which 63 were obese and then 18 of them were morbidly obese. Results revealed from the study that there were significant changes in physical activity, physical self-worth, and self-esteem for those who were in the exercise therapy group, and there were also positive changes. Lastly, the last study is by Di Stefano and colleagues in 2000, which examined effects of a 12-week aerobic and resistance training program on weights and body composition of 15 obese boys. The results showed that there was significant decrease in percentage of body fat, and there was an increase in peak volume of oxygen uptake, resting energy expenditure, and fat-free mass for those who exercised. Now let's look at the effectiveness of therapeutic use of exercise on physical performance. So in the first study by Rowland and colleagues in 2007, they conducted a study observing the effects of a 1-year exercise program on performance of activities of daily living on 134 nursing home residents with Alzheimer's disease. The results of the study show that exercise significantly slowed decline in ADL scores, which are measured by the CATS index. So over time, through exercise, they will still be able to perform the activities of daily living better than those who did not exercise. The second study is by Klin and colleagues in 2004, who studied the effects of a 12-week anaerobic training program on 20 children with cystic fibrosis. The results of the study showed significant improvement in anaerobic performance, aerobic performance, and quality of life in the treatment group, which is the group who did the exercises. In the last study, Merriman and colleagues in 1996 studied the effects of a 12-week physical fitness program on 22 individuals who had a dual diagnosis of psychiatric problems and mental deficiencies. The results of the study showed significant improvements in muscular endurance, cardiorespiratory endurance, and flexibility for those who exercise. Okay, so now let's look at the effectiveness of therapeutic use of exercise on cognition. So in the first study by Vault and colleagues in 2013, they conducted a study on the effect of cycling exercise on neurocognitive abilities of adolescents with intellectual and developmental disabilities on 11 adolescents. The results of the study showed that there was a temporary enhancement of neuronal activity after exercise. So once they finished exercising, there was an improved and more activity within the neurons after exercise. However, it was temporary. Second study was from Bala in 2014, which they conducted a study on the effects of physical exercise on the ability of children with varied intellectual abilities to solve basic math problems. This study involved 288 preschool children and 13 other children receiving special education. The results from the study show that the kids who did exercise had improvement in their math abilities afterward. The final study we're going to review is from Bricking and colleagues in 2014, and they examined the effects of 8 to 10 weeks of exercise for progressive multiple sclerosis. For those who exercised, the participants, there was improvement in aerobic fitness at several domains of cognitive function, in a walking ability, depressive symptoms, and fatigue. Therefore, from all these 9 different studies, it is shown that exercise does indeed improve in different domains, different functions of the human body, and that exercise is very, very vital and a great way to use as a therapeutic medium to promote change and improve the quality of life of therapeutic specialists, therapeutic recreational therapists clients. Thank you guys for listening and watching, and that will be it.